Good morning, students. My name is Kahremi Whettspot, and today I will be discussing the brainstem and cranial nerves. Now put away the lotion and try not to stare at my breast so we can get started. The brainstem consists of three parts: the midbrain, pons, and medulla oblongata. Together, these regions control basic functions essential for survival, like breathing, heart rate, and sleep. The midbrain is the top part of the brainstem and is responsible for controlling movement, hearing, and vision. Some important structures in the midbrain include: the red nucleus helps control movement, especially for fine motor skills and limb coordination. It plays a role in the motor pathway, helping with actions like walking or reaching. The substantia nigra is a part of the basal ganglia that is involved in movement control. The substantia nigra produces dopamine, which helps the brain manage smooth and coordinated muscle movements. Damage to this area is linked to Parkinson's disease. The superior colliculus helps us process visual information and controls eye movement. It helps us look at things that move quickly in our field of vision. The inferior colliculus processes sound information. It helps us detect and understand where sounds are coming from. The midbrain contains two cranial nerves: the oculomotor nerve, which controls eye movements, and the trochlear nerve, which also helps move the eyes. The pons is the largest part of the brainstem. It acts as a bridge, connecting different parts of the brain and helping relay messages between the brain and the spinal cord. The pons works closely with the cerebellum to help coordinate movement and maintain balance. It sends signals that allows for smooth movements and proper posture. Locked-in syndrome occurs when there's damage to the pons. People with this condition are fully aware and awake but can't move or speak because they're paralyzed, except for their eye movements. The medulla oblongata is the lowest part of the brainstem and connects the spinal cord with the rest of the central nervous system. It controls involuntary functions like breathing, blood pressure, and heart rate. The dorsal respiratory nucleus is located in the medulla and helps regulate the rhythm of breathing. The inferior olivary nucleus in the medulla is involved in motor learning and coordination. It sends signals to the cerebellum to help improve motor skills over time. The major ascending sensory tracts in the brainstem are: the spinothalamic tract. It carries pain, temperature, and touch signals from the body to the brain. The dorsal column-medial lemniscal pathway. It transmits touch, vibration, and proprioception signals. The spinocerebellar tract sends information about the body's position to the cerebellum, helping with balance and movement coordination. And the trigeminal lemniscus carries sensory information from the face, such as touch and pain. The major descending motor tracts in the brainstem are: the corticospinal tract, which controls voluntary movements, especially fine motor skills of the limbs. The corticobulbar tract, which is involved in controlling muscles in the face, head, and neck. And the reticulospinal tract, which helps control posture and balance, especially during automatic movements like walking. Upper motor neurons are found in the brain and spinal cord. They send signals to lower motor neurons, which directly control muscle movement. The reticular formation is a network of neurons in the brainstem involved in controlling wakefulness, alertness, and arousal. It helps keep us awake and aware of our surroundings. To stay conscious and aware, the brain needs signals from the reticular formation, especially in the midbrain and pons. If these areas are damaged, a person may lose consciousness. A coma is when someone is unconscious and doesn't respond to any external stimuli. In a vegetative state, a person may open their eyes and have some reflexes, but they are not aware of their surroundings. The Glasgow Coma Scale is a tool used by doctors to measure a person's level of consciousness after a brain injury. It looks at three things: eye opening, verbal response, and motor response, scoring each from 1 to 5. There are 12 pairs of cranial nerves that connect the brain to different parts of the head, neck, and trunk. The olfactory nerve and optic nerve are considered tracts of the central nervous system because they connect directly to brain structures and are surrounded by central nervous system tissue. The olfactory nerve is a sensory nerve that controls the sense of smell. Damage can cause a loss of smell or anosmia. The optic nerve is a sensory nerve that controls vision. Damage can lead to vision loss. The oculomotor nerve is a motor nerve that controls most eye movements, pupil constriction. Damage can cause diplopia or ptosis. The trochlear nerve is a motor that helps move the eyes down and toward the nose. Damage can cause double vision. The trigeminal nerve is a sensory and motor nerve that controls facial sensations and chewing muscles. Damage can cause facial numbness or difficulty chewing. The abducens nerve is a motor nerve moves the eye outward. Damage causes double vision. The facial nerve is a sensory and motor nerve that controls facial muscles for expressions, taste, and salivation. Damage can cause Bell's palsy or facial paralysis. The vestibulocochlear nerve is a sensory nerve that controls hearing and balance. Damage can cause hearing loss or dizziness. The glossopharyngeal nerve is a sensory and motor nerve that controls taste, swallowing, and saliva production. Damage can affect swallowing. The vagus nerve is a sensory and motor nerve that controls the heart, lungs, and digestive system. Damage can cause difficulty swallowing, hoarseness, or problems with heart rate. The accessory nerve is a motor nerve that controls muscles in the neck and shoulders. Damage can cause weakness in shoulder movements. The hypoglossal nerve is a motor nerve that controls tongue movements. Damage causes difficulty speaking and swallowing. A fixed, dilated, non-reactive pupil can be a sign of severe brain injury or pressure on the oculomotor nerve, often indicating life-threatening conditions. Diplopia, double vision. Diplopia can result from injury to the oculomotor nerve, trochlear nerve, or abducens nerve, as all these nerves help control eye movements. Injury to the vagus nerve can result in difficulty swallowing, voice problems such as hoarseness, or issues with heart rate and digestion. The trigeminal nerve detects the sensation on the eye surface, and the facial nerve triggers the blink response. The reflex also involves part of the brainstem. The jaw jerk reflex is a quick upward movement of the jaw when the chin is tapped. This reflex is mediated by the trigeminal nerve. Swallowing has three phases. Number 1. In the oral phase, the tongue moves food to the back of the mouth, controlled by the hypoglossal nerve. Number 2. During the pharyngeal phase, the muscles of the throat push food down, controlled by the vagus nerve and glossopharyngeal nerve. And number 3. During the esophageal phase, the esophagus moves food to the stomach, controlled by the vagus nerve. In conclusion, the brainstem and cranial nerves are essential for controlling vital body functions and connecting the brain to the rest of the body. Understanding their functions helps in diagnosing and treating neurological conditions. I would like to thank you all for being here. I hope you found it informative and helpful. Until next time, I am Kahremi Whettspot. Happy studying and good luck. You now have 10 seconds. Go ahead and stare.